Reliable and high-quality maternity care is a critical need for all women, but that care is being threatened, putting mothers and babies at risk as hospitals nationwide close their labor and delivery units in droves.
The March of Dimes says longer travel distances to access care can increase the risk of maternal morbidity, heighten prenatal stress, and result in adverse infant outcomes, especially in emergency situations. The organization also found that in 2022, there were more than 2 million women living in maternity care deserts, shown here on the map in red. These counties all lack obstetric care and providers. Experts say financial hardship, staffing issues, and the decreasing birth rate are causing the widespread closures.
Reporter Heather Graff takes us to a community where a recent closure motivated a family to go the distance for care.
I think it's one of the biggest things that you can go through in life.
Alicia Alderson is a mom of 3, and she knows firsthand how big a deal it is to have a child.
It's life-changing, it's scary, it's dangerous, it's overwhelming and beautiful, but it can come with so many possibilities for things to go wrong.
At 45 years old, doctors warned Alicia about possible complications with the birth of her youngest daughter, Ava, born in September 2023. But no one warned her about this.
I think it was the day after I decided to take an early maternity leave that I found out that the labor and delivery unit would be closing.
Just months before her due date, Alicia learned the maternity ward in Baker City, Oregon, where she was set to deliver, was shuttering. And the closest labor and delivery unit for her now would be 45 miles through a mountain pass.
I imagine that was a pretty stressful time.
Yeah, absolutely.
Alicia had to make a quick decision. Where would she give birth?
Trying to get through a pregnancy at this age isn't easy on its own. Then just on top of that, having to try to figure out where to deliver and what the safest choice is going to be for the baby and for the family is overwhelming.
The Aldersons chose to cross state lines to Idaho, where they could stay with family and access a hospital nearby.
I'd always given birth around 37 weeks. So we wanted to be somewhere where we felt safe, where we knew we could get to a hospital quickly.
It's a challenge many across the country are facing, because while rural hospitals provide healthcare access to more than 60 million people, a recent report from the Center for Healthcare Quality and Payment Reform found that fewer than half still offer labor and delivery care. Over the last decade, more than 200 stopped delivering babies, and hundreds more are at risk.
Trying to meet that challenge of recruiting, retaining workforce, providing all the equipment that you need in areas of declining volumes, it becomes sort of a perfect storm of presenting a challenge to access.
Dr. Chris DiRienzo is chief physician with the American Hospital Association and says financial hardship from low reimbursement rates is also taking its toll on these facilities.
That Medicaid covers just under 50% of deliveries in this country, and it rarely provides the resources even needed to cover cost of serving its population.
The Centers for Medicare and Medicaid Services declined to speak on camera, saying in a statement, while states can establish their own payment rates, states are required to ensure that Medicaid payment rates are efficient, economic, and sufficient to enlist enough providers so that care and services are available under the state plan. However, in a 2020 study, the nonprofit Healthcare Cost Institute compared Medicaid payments to employer-sponsored insurance payments and found, on average, Medicaid paid more than $8,000 less.
This all truly comes down to finances and where we decide we want to distribute our medical dollars.
Healthcare providers say they're concerned about how funding gaps are impacting those most in need.
Historically, moms and babies haven't ranked, quite frankly, terribly high on the list.
Outside Nashville, Dr. Eric Scott Palmer practiced in a hospital that recently closed its maternity ward. And he says cutting access can have devastating consequences.
People can't make their appointments. Care falls through the cracks. Preventable things are missed.
As a neonatologist, he says every second counts.
I don't get 45 minutes to get called and come in to take care of that baby, or an hour or 2 hours. I've got 5 minutes, I've got 3 minutes. And if you don't intervene in that quick period of time, that baby is going to suffer for it.
So with communities grappling with how to address this growing crisis, some states are trying to find solutions.
What I see at the state level are the kinds of more rapid cycle innovation changes that are going to be needed to solve for each local population.
In Connecticut, Governor Ned Lamont recently signed legislation licensing freestanding birth centers to operate as an alternative for women with low-risk pregnancies.
When you want to start a family in this state, we're going to do everything we can to help support you.
And in Iowa, lawmakers approved a family medicine obstetrical fellowship program, allocating more than $500,000 to maternal health services in rural and underserved communities.
What gives me hope is our healthcare system is always capable of innovating and finding new and creative ways to serve our communities.
No matter how you look at it, it's a good investment into our society.
Despite everything her family endured, Alicia Alderson welcomed a healthy daughter into the world.
Hi.
But she says the impacts from those uncertain months will stay with her forever.
I don't think it really hit me until we got home. We walked through the door, then I just started bawling. I just couldn't believe that we were here. The baby was safe. It had been such a huge life-changing ordeal.
And Alicia doesn't wish her experience on any mother, adding, the time to act is now.
Because if we don't take care of our children and take care of our families and provide those services that they need, we won't have anything.
According to the March of Dimes' recent report, in 2020, nearly 1,000 women nationwide died of causes related to pregnancy. That's a 14% increase from the year prior and a 31% increase from 2018. With more than 3.5 million births in the U.S. annually, experts say the need to address maternity care deserts has never been more urgent.